Good afternoon. We want to just thank you for joining us today for the Flint Community Webinar on Coronavirus, sponsored by the Healthy Flint Research Coordinating Center. It is our delight that you've joined us today, and we have an absolutely impeccable program for you today. I'm excited about what you will be able to hear today. So we want to let you know that it has been 45 weeks now, 45 weeks of an amazing partnership. And we won't have the opportunity today to tell you about all of the partners, but I do trust that when you have opportunity, whether you're on Facebook, you're looking at this via YouTube, or even going back and just look and you're here on the webinar today, we want you to just help us appreciate all of the wonderful community partners who've chosen to assist us every week, bring very important and relevant information to you, the community. Those of you that have participated for these 45 weeks, we could not have done it without you, because your input, your involvement has helped us continue to evolve and make sure that these webinars are relevant. And want to just let you know right now, we are live on Facebook. So for any of you that would like to have friends, family, join us. Share it with your network of friends right now, because I think the information today you will find most helpful. The Healthy Flint Research Coordinating Center is a community academic partnership designed to help us really seek to better understand how we can engage our community in these community academic pursuits. Now, today, we committed to you today that we would have a moment, a couple of moments, what we call it a mental health mindness moment. I know all of us in these last few weeks have been challenged by all of the things that have happened in our nation. For those of us here in Flint, on top of the water crisis, and now we have so many other things going on with that, the pandemic, the list goes on. And sometimes that generates a kind of trauma that we have difficulty really channeling through. So we've tried to make it a real important part of what we do is to bring to you some information that would help us with our mental health and mental wellness. So today, as we promised, Katie Baxter is here with us. Katie is from the Genesee Health Systems. As you can see here, she is a Senior Director of Clinical Services, and she's prepared something for us. So we want you to kind of sit now, settle yourselves, relax a moment, and Katie will take us through this exercise. Good morning, Katie.
Good morning, Yvonne, and thank you so much for having me. Thank you for having Genesee Health System and remembering how important our whole body health is, our mind, our body, and our soul. All aspects of our health are important. So thank you so much.
You're welcome.
The next slide.
Oh, Katie, we didn't get your slide. So if you just go, let's go back and just take us through the exercise.
Okay, good. All right. I'm going to invite you to join us for a breathing exercise. And it's just a brief mindfulness exercise, but it's an opportunity for us to learn some ways of self-care. And it's so important that we're taking care of ourselves, not just our physical health. We have a lot of talk about that, and it's so important. But our mind and our spiritual health, all of these aspects of who we are, our emotional health, are all important. So I'm going to invite you to join me in a breathing exercise, and it's just brief, but it'll give you a little taste about mindfulness and some of the techniques you can use to kind of get yourself centered. So I invite you to just get in a comfortable position. And before we do that, I want to remind you that the three important components to mindfulness: intention, attention, and attitude. Intention is what you hope to get from practicing mindfulness. Attention, mindfulness is about paying attention to your inner or outer experience. And our attitudes are so important. Mindfulness involves paying attention to certain attitudes such as curiosity, acceptance, and kindness. I will now invite you to join me in the breathing exercise. I encourage you to make sure you're in a comfortable position, your shoulders and your arms relaxed. Sometimes we do not even realize how tense our shoulders or our bodies are. So take a minute to try to get your shoulders and arms in a relaxed position and your feet, both feet on the floor. Now I will invite you to close your eyes if you're comfortable. If not, feel free to keep them open. I invite you to focus on your breathing. It is helpful to bring an attitude of curiosity to this practice, like you're noticing your breath for the first time and you want to learn exactly what it does. I invite you to place one hand over your chest or abdomen and notice the movement each breath creates there. No need to change the cadence of your breathing. Just relax your body and breath. Observe each inhale and exhale without changing your breathing pattern. Relaxed and comfortable. As you inhale, notice how your chest gently rises. As you exhale, notice it deflate. If your mind wanders, don't worry, be kind to yourself. Simply refocus on your breathing. Focus on the sensation of your chest rising and falling with each breath. Notice the inhale and the exhale. Try to notice each breath of air as it travels down your nose and throat to your chest and diaphragm. Follow the journey of your breath as it travels back out again. Each breath brings life-giving oxygen to all of your cells and your vital organs. Notice how relaxed your body and breathing are. Notice any sensations of warmth or tingling. You are relaxed and calm. You are safe. Now I invite you to open your eyes if they were closed. You open your eyes, rested and rejuvenated. It's that simple. You did it. You just practiced 2 minutes of mindfulness breathing, being totally present in the moment. So give yourself credit for participating in the exercises you were able to. I hope you found it refreshing. Mindfulness breathing is a quick and simple way for us to take care of ourselves and keep ourselves centered now and always. So thank you so much. Back to you, Yvonne.
Thank you, Katie. I was almost getting a little too mindful. Relax. I guess what I learned from that exercise is when we do that, we do it carefully, it might allow us then to take a little nap that then helps us relax our bodies even more. So thank you, Katie, for that exercise. I hope nobody went to sleep, because now we have an exciting roundtable for you. We thought we'd start off with this mindful exercise because we do have some very challenging issues that we continue to have to address in our community. And one of the things that's been important and we've talked about over time is the input, the perspective of the faith community. As most of us listen now all across this country, they're saying, where are the faith leaders? Let's get the faith community to help us in this COVID vaccine conversation and COVID update. So today we have with us Pastor Ezra Tillman Jr., who is a pastor of First Trinity Missionary Baptist Church here in Flint. We have with us Miss Renita Bingham. She works for Planned Parenthood, but she's also working on a very interesting degree I think she'll tell us about. We have Dr. Lawrence Reynolds, who is the Chief Health Advisor of the City of Flint, but he is also a pediatrician. And then Bishop Urandi Knox, who is the Senior Pastor of Ebenezer Ministries. We're going to ask them to open up their cameras right now because we want to see you in gallery view. And so all of us will have this conversation. So I just want to welcome you today, Pastor Tillman, Bishop Knox, Renita. Thank you so much for being here with us today. We just want to actually go through now and have each one of us share your perspectives. We want to hear from pastors. What has it been like for you We know, again, we've been through the water crisis, but now here you are as a faith leader being asked to share again and lead your congregations through this pandemic. So let me begin with you. Let's begin with you, Bishop Knox. What's been your perspective on the whole issue around the coronavirus? And you'll have to unmute yourself, Bishop.
First and foremost, thank you for inviting me on today. Really appreciate it. And thank you, Katie, for giving me those breathing exercises. And you be careful. If you kept that going on just a little bit longer, I felt myself about to doze off. So thank you so very much for that exercise.
You're welcome.
What I want to say is that this has been the most challenging thing that I have ever experienced in my entire life, pastoring through a pandemic. Everything was new. Everything now was not relying on my instinct, not relying on my experience, but now really relying on God, trying to hear a message of how to operate during this time. I had made the decision early on to close our doors, which didn't come with more popular responses I had wanted, but it was my decision to do this because I wanted to keep the people safe. We thought we would do it for maybe a month, and then it turned into a month and a half, and then 2 months, then 3 months, then 4 months. And if anyone knows about people and behavior, people's behavior will change after a 3-week period of time, let alone the months that we've been out of church. So I know that when we do reopen our doors, it's going to look quite different. Many people that used to go there may not attend anymore because habits change. Yeah. But for me, my biggest reason for doing that is because I know the health condition of the people within our congregation. They had some pre-existing situations in their life, such as diabetes. Some of them, if I can say openly, obese. They had problems with their weight. There were people who had, many people that were cancer survivors. I did not want to expose them to someone who may have had the virus, since we did not know how this was being transmitted, other than being airborne and or by touching even our facilities. We then researched to see how we would get our facility fumigated. The cost was astronomical. I believe we looked at a $30,000 cost to have the entire congregation, the entire building fumigated at that particular time when it first came out. They were going to come in with some steamers and steam the carpets and steam the pews and wipe down each and every one of the pews and the microphones, et cetera, et cetera. And then you would have to do it on a weekly basis. We did our research. It would not be not only cost effective, but it also would put our people in danger. So that's been my experience. I can elaborate on and on and on, but I know there's more people on the panel. And if you allow me to jump in again, I certainly shall. Thank you. Yeah,
we'll come back to you, Bishop, because there is more. And I do want to hear from you, Pastor Tillman. Again, one of the historical churches in our community. As a young man, you came into pastor. What's it been like for you?
It's been a time of number one, being woke, considering that across this country, so many other issues are oppressing our community as it pertains to the African American, and learning as you walk with people. I was raised in old school, so I understood pastoring was not just being a preacher, but living among people, and whatever touches their life touches your life. So as I look at my parishioners, I also look at my parents. I'm looking at my grandmother. I'm looking at uncles. I'm looking at aunties. And so that's always kind of a lens to help you kind of consider, how do you give care? How do you give advice? And I think even as some of the particular expertise and experts rather, and government to try to use our voice or ask for our voice to help message this vaccine out to our communities, they understand as well the importance of the information that the pastor gives. So for me, it's been a time of being open, watchful, and cautious. I agree with Bishop that, you know, as we think about how to move forward, everything is changing, everything is shifting. You learn to adapt. You're looking at your budget. You're looking at how do you move forward to another year as we in now, what that will look like if we're not able to get back into our churches. Can we afford to keep up the cost for COVID and not receive other funding from the government to do so? Because that was another problem in our community, that other evangelical churches, Catholic churches were getting funds before we even knew it was out. One of the most affected communities were not being supported financially from the government to provide ways of keeping our churches open and servicing our communities. So on every level, continually, you're looking at so many roadblocks and challenges you're facing. So it's been a time definitely that made you to, as the old saying would say, keep the Bible in one hand and newspaper in the other.
Yeah.
So I'm reading and I'm watching CNN daily.
Yeah. So, I listen to both of you as leaders, pastors in this community. And Bishop Knox, you pointed out that you were concerned about your members. You actually know your members. You were considerate of their health conditions and made decisions. Pastor Tillman, you said not just pastoring, but being a part of the community where the people are. And so this one last question before I go to I'm gonna say Sister Bingo, is as a pastor, looking at all of these, and you said having that newspaper in the hand, how important is it to you to have the information from the science world, even though you're faith believers? Bishop.
Beyond a shadow of a doubt, when we began this process to understand Dr. Fauci, I was following him from the very beginning. Something attracted me to him. I don't know, I am a CNN watcher as well. And when he would come on, I listened. I do believe in the science. Otherwise, I wouldn't have a medical doctor myself. If I can believe my medical doctor, then currently, if this gentleman is even higher above my physician, then I certainly can hear him, and hopefully that he's hearing from God.
Thank you, Pastor Tillman.
I agree. I think that one of the most important words we can use in this season is wisdom. And I think that being zealous have led many people to great dangers. And we've seen other pastors who try to, promote this place of faith to be, I guess, overriding of what the specialists are saying, which have led to many of them being buried as well. So, that's a concern we have. If we are really truly shepherds, we have to also consider that if God have given us a calling and anointing to lead and do what we do, he has given the knowledge and understanding to scientists to do what they're doing as well. Although we may have cautions, there may be hiccups or whatever, we still realize that we need to respect the space and place that people are in. As Dr. Bishop said, because I got a doctor too, and I ain't got one of them complexes. I go get my regular checkup.
So you're not one of those had that complex, right?
I'm not one of those.
Thank you, pastors. Now, Sister Bingo, now we invited you to be a part of this conversation, and there are a couple of reasons. I know from working with you historically that you were working in a church. You're one of the members of one of the larger churches here in the Flint community as well, but you took a little bit different pathway. And we had our mental health moment earlier, but as a woman of faith, you're working for Planned Parenthood, but you're also working on your master's degree in clinical mental health counseling. So how does this all fit in with our whole world? We faith believers, because I love God, but help us to understand this role and how you see it affecting us from a faith perspective.
Yeah, so first, thank you again for having me in this space. I think it's very important for us to be represented in spaces, especially mental health care, because there's so much stigma around going to the counselor, right? Because we do have Jesus, and we believe that, Jesus is the way, that you put your all on the altar and, leave it there, and he'll take care of everything. But oftentimes we can't disconnect, right, to the things that are processing in our minds. And so he does provide people to help us navigate that space as well. Jesus was the ultimate counselor. So I think that in that way, in that aspect, that he also provides wisdom, as we just heard about, to individuals to help us navigate spaces when it comes to, when people have a hard time detaching their issues, their mental health issues with ruminating, things, anxiety and depression and things of that nature. So when it comes to this space of mental health and the faith-based community, it's a gray area at times. And oftentimes we see pastors, you know, trying to being overwhelmed because their parishioners come to them asking, you know, help, not just, you know, for biblical guidance, for emotional and mental guidance as well. And oftentimes they don't have that capacity to do that. So I think it's important for me, especially, I'm attending and almost done with my master's, to attend a Christian college, a Christian university right now, where we're integrating not only mental health, but Christian-based mental health, so that we can come back, serve our community in that way. So I think it's very important for us to be represented in this space as well, not just you know, going to see like we said, our doctors, because they focus on one thing, but getting help in a mental health is a whole totally different category in itself.
Right. So sometimes we actually forget that a mind is a part of our body.
It is.
You can't take the mind out. You know, body's not a whole lot of good. So this is relevant because, Bishop, you focused a lot of work in the last few years actually on the whole issue of mental health and faith, and you've done some things in that regard. So I'd like to again ask pastors, you know, how are you considering conversations within your communities about faith and health, but also faith and corona? Bishop.
Faith in health, faith in corona, faith in the mind, they all go together. I'd say the first thing I did was I developed a partnership. I don't know if I can mention that partnership on this particular platform because I don't know if they're actually a sponsor at this point. But anyway, there's a local mental health entity that I partnered with.
That's fine.
From the very beginning. Oh, okay. I partnered with the Inner Center because one of the things, as I share with you, as I can share with you at this time, one of the problems that I felt pastors have, and we still need to work on, we feel as though we can fix problems of everything and everyone because we are the prophet of the house. My thing was to make sure we had someone that was qualified in the mental health field. And I would then personally, and from the last 5 years or so, have been referring individuals to go see a mental health professional, a counselor, someone that could walk them along the way. This coronavirus then put us in a position where we now, the church and our membership, not only are they dealing with the other issues that they had prior to this isolation, they now need to have a way to talk to someone because many of our members are single and many of our members live alone, for instance, had no one else to talk to, and the church was the source or the place that they could come, have that congregation, meet one another and have some needs met. So mental health is very, very important to me in our ministry. In addition to that, talking to people about coronavirus and asking, was it real? Our congregation had, without a shadow of a doubt, knew that it was real from the very beginning because many people have been affected by it.
So thank you, Bishop. And while you were talking, I saw Pastor nodding his head and Sister Renita. Pastor, tell me, what do you say about this?
I as well have saw on the front end of dealing with the water crisis, importance of trying to find help and give spaces for people to get the care they need. At that time, I would just kept running to people who was breaking down overjoyed of water because anyway, they're dealing with issues. Their dog is sick. They're losing their hair. They can't take a shower. I mean, so those things kind of bled over into the COVID experience, which was another trauma while we still yet in the middle of a crisis. It's not over in Flint. That's not servicing the people who really need it the most. So it's just like another, valley after a mountain, so that's one of my pieces I've learned. I've always continued to say this, that I push Jesus and a therapist. And I have no problem with it. And to my pastor friends, they heard me say it for years now, as I try to push them about health insurance, about retirement. I also push about having a therapist because, like as Bishop said, everyone comes to you with the issues. And many times you're carrying their burdens home. And while you being a prophet to their house, you're not being a prophet to your own house because you're off balance.
All right.
Everything is not demonic. Some stuff is off balance. And so you can slang oil if you want to. Somebody needs some medication. Okay. So somebody has reached this level of stress that cannot contain, they're out of character, they're depressed and don't know it. And so that's when you need the lifeline. I do believe in this season we're going into now that we're going to have a therapist or a counselor in the church, like we need a youth pastor.
Yeah.
In a different season.
Yeah. So again, now with you, Sister Renita, you're studying this now. So how does this resonate? This conversation even today resonate with what your experience is in getting clinically trained, academically prepared for this conversation?
Absolutely. So I just want to acknowledge that it's not easy, right? You spoke to my being in church administration. I was in church administration at Manala for 4 years under the leadership of Dr. Stewart. And we had lengthy talks, and oftentimes he would pull me into, sessions and say, take the notes. And from that point, a seed that was already planted was nurtured. And he encouraged me to go and get proper education in the area of counseling because I was doing it, right? So as I have been matriculating in this process, I was asked a question. I took a class in crisis intervention, and they asked, has anybody been through a crisis? And I was like, nope. Not really. But when I opened up the book and I learned the definition of what a crisis was, I said over and over and over and over, have I been through crises, through the water crisis, like what was expressed before. I was pregnant during the water crisis. That was a crisis on top of a crisis. Now during COVID as well, I'm expecting this again, a crisis on top of a crisis impacted. And then what they called OJT, or on the job training. This is experience that is unprecedented for so many, but for me as well, because I'm learning how to navigate this space of crisis and then help others navigate their space, their mental health space, while I'm trying to care for myself and my family as well. So seeing as the issues that we have today, I know that we don't have a clear picture of what will the consequences of all of the virus and still dealing with the issues of the water crisis as well. But I know that for a long time, I totally agree that there needs to be a space in our faith community, in our churches, for a therapist as well. And that's one of the things that I might continue on my education and providing that space in our faith-based community for that. So I'm looking forward to engaging in the faith-based community. I'm still there. I haven't left. But I definitely see a need for that in moving forward to partner, like Bishop was saying, he partnered with NS and just incorporating. And I think this matters as well. Representation matters. So when you say, having a therapist in a church, them understanding and having a relationship with Jesus, but also having the understanding and the knowledge of how to walk them through a mental health issue or crisis is very, very, very important. And it's not a lot of people who have that knowledge in that space. So it's very important during this time too, that God has called me, because I do believe it's a calling, that he called me and pivoted my life in 2018 to start this journey. And he has been walking in tandem with me and allowing me to see the benefit of this calling on my life.
So it is a journey, and we're on that journey right now. And this conversation is a journey. We don't have enough time to cover all the topics that have even come to my awareness, even in this moment. But as pastors, you've mentioned a couple things, and even with what you said, Sister Bingham, education is important. We get ministerial training. Many people get ministerial training, but there's also the academic training that goes along. So when we can marry or integrate our faith with our academic training and keep some balance is really important. I have to close this segment out, and I want to thank you, pastors, Bishop Knox and Pastor Tillman, for joining us, and Renita. But one thing I just want us to touch on, we know in our faith community, That is where people come to get loved on when they don't find love someplace else. That is something where we gather to support each other in the midst of crises. And that's one of the big challenges. So in just a couple words, pastors, if you could say, when we can't gather for funerals like we normally do and love and support each other, what would you say to those of us that are listening today in an encouraging way that would help us get through to the other side? Let's start with you, Pastor Tillman.
I would say that it's a most needed time for you to personally make sure you seek a relationship with Jesus Christ. As much as we try to preach that on Sunday morning and tend to push you coming to the community of the church, we're trying to tell you that part of the church is you being a believer, not necessarily being in the building. And now that we're not in the building, people need to realize that connection that we've been trying to teach you through devotion, through prayer, through reading the scriptures, through actually understanding and having a relationship with the Holy Spirit is necessary, because now as you're walking through this journey, and it seems to be lonely and it seems to be alone, now you understand when we're trying to preach to you that he'll be with you always, even to the end of the earth. And I think right now, through every season of my life, that needs to be the most important piece that keeps you grounded of not only what you experience in the sanctuary, but what you need to have in your heart. So for now, in this time of season, I'm trying to push people to make sure that you have that peace and the surety of you knowing what you know, trusting God. So that's my encouragement to the believer. If you know what you know, you hold fast to that.
Thank you. Bishop, I'm going to hold you, but I want to just have Sister Raynita, from that clinical perspective, from that, give us a tip.
Yes, definitely what I'm encouraging my clients that I currently have in sessions is to focus on you. A lot of them, they come to me with, symptoms of anxiety and depression and isolation, increased isolation. So we're working to say, how are you coping? The coping mechanisms, and a lot say, I'm praying. Of course, we're going to lean on our faith and to get us through, but encouraging yourself, taking time to really know who you are in this time and space will ultimately lead us to our purpose. Some people have lost purpose, but I am increasingly telling folks to take like mindfulness, like we had the opportunity to do before, understanding that it is important for us to get centered and balanced as well. So just incorporating mindfulness techniques, making sure that we're taking care of ourselves, because at this time when we're isolated and we cannot spend time with others, being comfortable with yourself in that space is very, very important, that we don't, our mind doesn't wander and start to, overtake us, and thoughts of suicide ideologies and things like that overcome us. So making sure that we're taking care of ourselves is the best way.
Thank you. Bishop, give us the last word for this segment.
I wish you would give me the amount of time that I have at the time. 2
Oh,
minutes
okay.
to my end of my discussion.
How about 30 seconds, Bishop?
Okay.
I know you can preach on this one, but just kind of bring it on in.
Okay, I'm trying my best. One of the things we found out, very, very briefly, we needed that piece on mental health. And we had some psychologists, a counselor and a psychologist from Ebenezer that worked with us to get through this. So we created a platform on the internet through Dr. Danica Perry, and also through Lisa Horn, a psychologist, counselor within our church. We then had the opportunity to work with a lady, her name is Reverend Athena McKay, who was doing our technology. And through our technology, we found out that that thing that everybody continues to hold in their hand, to work with, to talk on, to play with, whatever we need, we found out that everyone was still needing to be connected, even though we weren't in the church. So we began to offer the opportunity for our seniors to now learn the technology, how to get on Facebook, how to work on the phone, how to move forward so that they could stay connected, because immediately everyone went dry and blank for those that weren't in the technology-based field. Now what we're trying to do is making sure our seniors and everyone else is being up to date on their iPhones, iPads, or whatever they may have available to them. I think we need to continue to understand and embrace the technology and merge it with also our religious, spiritual institutions.
God bless you. Thank you, Bishop. Thank you, Pastor Tillman. Thank you, Sister Renita. And just stay tuned. You're going to be in the background. So if you have questions, of those of you that are in our webinar today, if you have questions, please put those questions in the queue. And I'm sure if they're going to be able to answer those questions for you. But our whole panel, as you can see, there are a number of our panelists are on today that'll answer those questions for you. So please put those questions in the queue. Again, let me thank you, this first panel, for being a part of this today. And it's not over. We just getting started, because we didn't talk to y'all about whether y'all got these vaccines or not. Don't have time to do that today, because Dr. Deborah Verholden is going to come and give us an update on the policy brief. We've been trying to brief you with the information that's come out of a wonderful partnership between Michigan State University and the Genesee County Health Department. So Dr. Deborah, can you bring forward to us today the updated information from the policy brief?
Yes, and thank you to all the faith leaders for sharing. So we got good news. We continue to see declines in our COVID case rates, both in Flint and Genesee County. 7th and 8th consecutive weeks for Flint and Genesee County, where the rates are going down. But as our wonderful generator of this report, Mary Catherine, says, we got to double down on these layers of protection, because a new, more contagious COVID variant has been confirmed in Michigan. More contagious just means it's more easily spread. I don't know your experiences, but I know of a lot of people, and I personally have been around 2 people who were COVID positive that didn't know it at the time, and I did not contract the virus from them. And they didn't know it because we honored the protocols. So even though I was in close personal contact with them while they were an active case and shedding virus, I did not contract the virus. Why? I'm not hugging people. I'm not kissing people. And it's so strange because, you haven't seen people in a long time. You just want to throw your arms around them. I don't do that. I give a fist bump, and it's really almost like the knuckle bump or the elbow bump. I continue to honor the protocols. So to hear that a strain is more contagious just means you really just got to be extra vigilant, and it's possible. And we've also heard that our national vaccine supply is currently exhausted. What does that mean for us? The health department is working really hard. We'll hear from Suzanne Kupel to ensure that the supply is distributed equitably. We know that there's a bit of a bottleneck and some clogs, and the system is not working as well as we'd like it to. That's true all over the country. I've heard people say, we had all this time to prepare and da-da-da. We did prepare. And guess what? Now we're in the game. And we haven't learned how to, and change the wheel while the car is moving. But know that lots of us are working very hard to smooth this all out. So we all just need to be patient while we figure it out. This is what the numbers look like. You'll notice that top bar, the kind of deeper blue one, is the unknown cases by race. We really want to focus on racial equity. We did a lot of work to eliminate those just jaw-dropping disparities that we saw in COVID early in the pandemic. I reiterate for folks, somewhere around mid-late July, we eliminated the racial disparities in COVID, both in Flint and Genesee County. We were previously African Americans overrepresented in both cases and deaths through the combined efforts of many across the city, which included faith leaders, people in the health professions, the philanthropic community, the business sector. Our own Isaiah Oliver, the president and CEO of the Community Foundation, chairs our local task force, and we work in partnership with the health department and with the Health Coalition. A lot of people came together. So we're moving in the right direction. In order to stay that course, we need to continue to get that government support, and we also need people to continue to do their part. Okay, next slide. So people have been hearing, okay, if the vaccine count, why do we need the vaccine if the case counts are going down? They're going down, but remember, we're still about 2 times where we were when we thought things were really bad back in March and April. So we're moving in the right direction, but it's far from over. And outbreaks come in waves. If everybody drops their guards and tries to go back to what it was like before, we will see another spike in our case numbers. And the long-term impacts of this virus on people, we don't want that. And I want to reiterate, people keep hearing about herd immunity, and I've heard people say, I'm just going to wait for herd immunity. You don't want to wait if you don't have to wait. The goal with herd immunity is to stop people from getting sick in the first place, not to have people build immunity through natural infection. And I want to be real clear, the immunity that you get through natural infection is a lot shorter than the immunity you will get from the vaccine. Maximum from natural infection, they're saying, is about 6 months. That is the maximum. It's going to take us more time to understand what immunity looks like from the vaccine, but we know that it's substantially longer than that. So what does it mean? This new COVID variant has been found in Michigan. Should you panic? Don't. All viruses mutate. That's the way they work. The mutations are not so significant that we wouldn't expect the vaccine to continue to work on this new strain. It does mean that this new strain is more able to move from person to person. Again, that's why it's important that people continue, even if you've been vaccinated, to honor the protocols. And this virus, the new strain, is not resistant to the antibodies that people have either through natural immunity or the ones that you get from the vaccine. So it's not a cause for alarm. This is something we got from the Johns Hopkins University website. They're doing a really great job of putting these very brief, easy to digest videos together. I encourage you all to go check them out, www.jhu.edu. Next slide. Okay, so recommendations for policymakers. We want to celebrate our residents, Flint and Genesee County, for doing their part to drive the cases down. It has to be that people are doing their part, because if they weren't, the cases wouldn't be going down the way that they are. We need to maintain and foster vaccine interest and demand while continuing to promote known safety measures. And my personal position is I do not tell anyone to take the vaccine. It's not for me to tell anybody what to do, but I want people to make decisions based on facts and based on information. So please, folks, continue to do the work. Get your questions answered. We're here. We got a lot of people here to help, and we need to support it. We need our policymakers to keep pulling those levers to get a national vaccine manufacturing and distribution strategy in place. We've now got a clog at the national level, which is creating a clog at the local level. All right, so we want, lastly, continue to invest in a strong public health system to support all of the many efforts that we have going on. How can you individually support the current COVID response and recovery? Well, the health department is signing up volunteers through the Genesee County Health Department Vaccine Clinic. If you get the health equity brief, there's a button on there. You can register there. You can also go to the health department's website, gchd.us/coronavirus for more information. And I also want to recommend that people get and download the My COVID Alert app available through the state of Michigan. And Brother Gary Jones can tell you all just a little bit more about that. I want to acknowledge and appreciate our wonderful Mary Catherine Crawford, our future change maker in public health and policy. She's the one who puts this brief together every week. If you're not getting it, sign up. If you are getting it, forward it out to people. There's a simple link in there that you can click to register. Her email is crawf, CRAWF 457@msu.edu, and she will make sure that you get on the list. If you have any questions or comments about the data, our own native homegrown Flint geographer, Dr. Rick Sadler, and his team are the ones putting this together in the background, and happy to help meet people where they are, fulfill on data requests, provide you graphics, etc. His email is Sadler, SADLER, so it's 2 R's, sadler@msu.edu. And of course, our wonderful public health director over at the Genesee County Health Department, and my colleague, Suzanne Kupel, at the health department. Her email address is scupal, SCUPAL, @gchd.us. Back to you, Yvonne. You're being brilliant on mute, as usual.
Oh my God. All right. So Dr. Deborah, thank you, because Dr. Deborah is our resident epidemiologist. She is not a medical doctor, so don't go to her if you got a broke toe. But if you want to understand this data and you want to understand some of the technical info that is being talked about, she is our person. Now, this next vaccine update conversation, Dr. Deborah was like me on the fence, but on January 2nd, she committed that she would get her vaccine. So now she did it. So in this, just a couple of minutes, these next few minutes, Dr. Deborah Verholden, who, as you can see, is the director of the Flint Center for Health Equity Solution, got her first dose, and also Suzanne Kupel. Suzanne, I'm going to ask you to join us now in this conversation, so I hope you can let us see you on your, stay on that slide, please, Tay, with Dr. Deborah's picture, because they're going to talk a little bit about their experience getting the vaccine. So Dr. Deborah and Suzanne, let's talk about what was your experience like.
Well, I want to be honest and say I was a heck no. When vaccine first came out, I was a heck no. You get it. That's why I said Pastor Tillman jaw gonna drop. Like, Dr. Deborah got the vaccine. I was a heck no. I had more questions than I had answers. And so I went on a relentless pursuit to get those questions answered. And I was surprised, and I raised a lot of doubt, and I kicked up a lot of dust in a lot of places. And there are many great public resources to answer the questions that people have about the vaccine. And I was unwilling to get it and make that decision to be a yes until I had all those questions answered. So I started off a heck no. And then over the course of several weeks, I became a no for now. And then I became a yes. And so I honor people and meet them where they are. My only thing is I don't want people to make a decision about the vaccine based on myths and bad information. I want people to make those decisions based on good information and facts. I believe and I know that knowledge is power, and I want people to be empowered with the choice. So I got my first dose yesterday. It's what's called an intramuscular shot. So they kind of juice your arm up a little bit, and then it was literally the smallest little short needle. I didn't even feel it going in. And as I was saying, are you sticking it in yet? He was already pulling it out and slapping a Band-Aid on me. Whole thing took about 15 seconds. He asked me if I had questions, ran through a few things for me. I had 0 side effects from the first dose. The only thing that happened is when I woke up this morning and I rolled over, it's a little tender right here. It's just a little tender. And they even gave me the choice. Do you want it in your right arm or your left arm? I said my left arm because I'm thinking I use my right hand and I don't want any discomfort. And the technician actually suggested that I get it in the right arm because I use it more. It would sort of help me to get back to normal. So I can feel it when I touch it, but it's minor. I have heard from people who've gotten their second dose that you get a little bit more of a reaction. And I want to let people know it's not because you're getting the virus. You're not getting the virus with the vaccine. The vaccine does not contain the virus. You cannot get COVID from the vaccine. That first shot is priming your immune system. That's why you have to get 2 shots. To get the full benefit, you've got to get the second dose. So shot number 1 is priming your immune system. Shot number 2 is giving your body the full court press response. And when your immune system is ramped up, you might get a little bit of a fever. Same way when you work out, you get hot. I shovel snow, and by the time I'm done, I got my coat off because I'm hot. It's your body working and doing what it's supposed to do. So more people are sharing about having a little bit more symptoms, following the second dose. And I will be happy in 3 weeks. I get my second dose 3 weeks from yesterday. So it'll be in time for the webinar. And I will share my experience after getting the second dose.
So Suzanne's going to beat you because Suzanne's going to get her second dose. So Suzanne, can you just kind of tell us, you got your first dose and you're close to getting your second dose?
I did. I got the Moderna vaccine on December the 30th at 1:23 in the afternoon.
You remember that date and time
I
to get you.
That date and time, and I remember how it felt to get it, that here's an injection of hope, that we actually have a tool that will allow us to address COVID-19. My next dose is scheduled for 8 a.m. next Friday. So I will be giving you an update next Friday on what my experience is with the second dose. Recognize that we've heard from a lot of people that after the second dose, you may have more discomfort in your arm. You may have some mild symptoms like a fever or chills or just not feeling yourself. And so I look forward to sharing probably the following Friday what the response is, because sometimes that takes 24 hours before you start to really feel the impacts. But I will say that, again, I thought of it as an injection of hope. The idea that we actually have a tool now that can help us address COVID-19. And the challenges, as Dr. Deborah has said earlier, is that we have a lot of people who are eligible for vaccine right now. We just don't have enough doses for everyone. So I look forward to working with this new administration, making sure that the vaccine is accessible to everyone who wants to receive it.
Thank you for that update, particularly on your experience. So now, Suzanne, if you could take us through some of the other updates, because, we've talked about, as you just so clearly mentioned, the supply. And we've talked so many times, we want people, if they're interested in getting the vaccine, to get signed up. So can we talk a little bit, if you would, about the process and the availability?
So I will say, let me just express to you the process that we go through. Each Wednesday, we ask for the number of doses that would be able to distribute in the following week. That does not mean that we're going to get what we ask for, and that's been the case for a while now. But we get that information submitted to the state. It's usually around Saturday that we get the reply back with how many doses that we're going to receive for the following week. And then our staff work diligently to get people contacted so that when for a week, because we submit the request for the supply of vaccine, then we get the notification that we're going to get it, and then we also then schedule the people for appointments. Now, I want to make sure everyone knows that we've had a switch this week in what we're doing in order to get people pre-registered for COVID vaccination. So again, remember, we're in the 1A categories and the 1B categories. That's everyone that's 65 and older. And those essential workers that are really essential, that might be exposed on the front lines, but they're doing things like MTA bus drivers, or it could be someone stocking shelves at the grocery store, or consumer power workers that keep our power on. Those folks are also eligible. On the county's website, and we'll share a little bit more about that, on the top of the left-hand side of the front page is a button that you can click, and it's going to provide you with information that you can share. So it'll be your name, your address, your telephone number, your birth date, your zip code, and some other information about what your role is. If you're a senior citizen, if you're an essential worker, what role are you in, that sort of thing. That's submitted to the health department, and then we will call you to schedule you based on the amount of vaccine that we have for that week. So you know that it's a 1 week process. On Wednesday, we ask for the vaccine supply. Usually on Saturday, we find out how much of supply we're going to receive, and then we communicate to get everyone's scheduled so they can get their immunizations that week.
Okay, and so in terms of availability, as you mentioned, it is on a rotate based upon what you're able to get in to the state. So once a person gets on that list, do they need to call you again?
No, they do not. So once you've gone through that pre-registration process, then the county staff here at the health department will connect with you and make those appointments and get you in. And recognize there are priority groups. So those that are 80 and older right now are a top priority. And anyone that is frontline, having direct potential exposures to COVID-19, who are high risk, who are keeping our infrastructure up and running. Those are the folks that are in those priority groups right now. Now, there are people who don't have access to the internet. And I think it's important for us to say that we are partnering with the county senior citizen centers and with the Valley Area Agency on Aging, so that that information is also coming from seniors to us so that we can make sure they get on the list and they're communicated with so they can get their vaccine. Now, there are other things that are happening in the works too. Again, we've been planning these immunization clinics for many months since last summer. And we are working with partners that will assist with those who have English as a second language, the deaf and hard of hearing community, and other more vulnerable populations. So we are working directly with those folks to help us with this process to make sure that the most vulnerable are going to be able to access the vaccine.
Yes. Well, Suzanne, thank you so much. Just one other thing I would like us to touch on in the next minute or so, and that is there are other potential opportunities for people. I got a conversation, someone got a call from their Meyer pharmacy.
Yeah.
So we want people to know too, not to try to get on two lists, just get on one list. But what do you share with us today about clarifying the different opportunities or places people can go to potentially get signed up for a vaccine?
So right now there's a partnership that's being developed among the major pharmacy chains. They do not have vaccine available at this time, but they are communicating with folks to get on their lists so that when they do have vaccine available, they'll be able to provide it. So the question mark here, what we're all trying to navigate through and figure out is when that vaccine is going to be available and how soon other partners will be able to help with this process. So that's coming. We also know that there are other vaccines that are coming through the FDA approval process. And currently, again, we have the 2 vaccines that are approved, Pfizer and Moderna. They both require 2 doses of vaccine, which logistically is a little bit more complicated than having a vaccine that's only 1 dose.
Yeah.
And there are others that are coming through the approval process that will be 1 dose. That will make it a little easier for people, particularly with transportation issues, to get the 1 single dose they'll need of that vaccine.
Thank you, Suzanne. And I just want to encourage our listeners, please stay tuned. These things are changing almost as we speak. I heard the governor give a talk on last week, and this week she's giving another one, because things are changing so rapidly. The most important thing is that we keep our eyes open, our ears open, stay tuned, and we'll be here as long as is needed, I'll have to say it that way, to make sure we get relevant information to you. Gary Jones is, thank you, Suzanne. Gary Jones is our community affairs representatives for the governor's office here in Flint. Gary, we got a couple minutes. Can you just give us those updates today?
You know, I can't talk fast, so I'm gonna try to go at the best pace as I can, because I always
hit the highlights, Gary. Hit the highlights.
All right, we're gonna hit the highlights. So actually, this is really important. Everyone is invited actually to an administrative update from the governor's executive office and the state budget office on the COVID recovery and COVID vaccine. That's going to take place today at 3:30 p.m. Yep, I see my contact information up there. So if you want the link, you can send me an email to jonesg9@michigan.gov. The speakers will include the Chief Operating Officer, Trish Foster. She's going to be giving an update on the COVID-19 vaccine. And the State Budget Director is going to be discussing the COVID recovery package. So again, if you're interested, make sure you send me that email to jonesg9@michigan.gov. And I will send you the link to be able to access that meeting. Also, Yvonne just spoke about this. Following last week's announcement about the plan to reopen indoor dining, MDHHS released its next epidemic order earlier today. The governor just recently held a press conference this morning in regards to continuing the department's fact-based approach to reopening activities. And it goes into effect on Monday, February 1st. So this order will allow for indoor dining at restaurants with certain requirements, concessions at casinos, movie theaters, and stadiums, personal services requiring mask removal, and non-residential gatherings of up to 10 people from 2 households. And recently, the governors and lieutenant governors from Michigan, Illinois, Indiana, Kentucky, Minnesota, Ohio, and Wisconsin joined together in a video to encourage everyone to make a plan for how they can get the safe and effective vaccine once they become eligible. So over the past 10 months, people from across the region have stepped up to fight COVID-19. States across the region are working around the clock to ramp up vaccine distribution efforts and end the pandemic once and for all. Together, the governors urge individuals to make a plan for themselves and their families on how they can get vaccinated as soon as possible. People are encouraged to visit their state health department's website for more information. And also recently, the governor announced the Michigan COVID recovery plan. And once again, we're going to have more from our state budget health director at 3:30 about this plan. Huge plan. I cannot say the word huge enough in regards to this plan. It will pertain to vaccine distribution, economic recovery, and we're talking about $2 billion for schools in addition to that. So just to give you an idea of the scope and the size of this recovery plan that we'll be discussing later on today. And lastly, just reminding everyone that the governor will be holding her 3rd State of the State address on Wednesday, January 27th at 7 p.m. And of course, due to the ongoing COVID-19 pandemic, the State of the State address will be held virtually in compliance with CDC and State of Michigan's best practices. Michigan.gov/COVID vaccine. Best website to keep up with everything pertaining to any and all questions related to the COVID vaccine. I'll repeat that one more time, michigan.gov/COVID vaccine. There's information on there in regards to how to get the vaccine, where to go about getting it. And it's, statewide. So everything that we're getting from our local health officials, we're putting it on that website as a good go-to and a good catch-all for everything related to the vaccine. And lastly, michigan.gov/coronavirus is still the best website for all updates pertaining to COVID-19 in the state.
Thank you, Gary. And I know people will use this. We have some announcements for you today, but as we're closing out our time for today, because we're committed to making sure that we use your time wisely, I just want to invite Afton to come back next week. Afton gave us this great information about recast applications, and she's going to give us an update on that next week. I want to just say to you today, and thank our faith leaders, thank our panels, both panels today, for being with us. And we talked a lot about faith today. Whatever your faith tradition, it's important from the mindfulness piece to now that you have hope in what's possible. So we want you to draw and build upon that. We're going to be back here next week. We've got some good information for you because next week we've been asked to talk a little bit about some suicide prevention. So please join us next week for that. Today, if you're interested in the CEUs that are provided through the webinar for our community health workers, please follow the protocols here, the various steps in order for you to receive those continuing education units. I'd also like to say to you today that you can like us on Facebook. Now that we're doing Facebook Live, we'd love to have more of you be a part of our Facebook community. And then subscribe to our YouTube channel, Healthy Flint, so that you can get all the information that we have available to you. And then email us for more information at info@healthyflint.org, or please feel free to give us a call at 810-835-2130. And we promise you, we will see you next week. Thank you for joining us today.